research is on the association between intrapartum opioid, fentanyl, and early breastfeeding, a prospective observational study, and this is the article that I'm thinking about using for my essay. The research problem is breastfeeding is typically disturbed early on due to hormone disruption and drowsiness post-birth. Epidurals are very normalized in birth, and most mothers do not receive informed consent to understand the risks of an epidural. And I also did some more research on the risks of epidurals, and it goes as far down as paralyzation depending on the dosage. So I can see how it would lead to also just in general latch problems, suckling problems for baby. The sampling method was at least 1,101 low-risk mothers with singletons, and it was 468 first-time moms and 633 two-plus-time moms. And the control group was assessed in 4 different types of groups. There was no exposure to opioids, exposure through an IV, exposure through a regular epidural with fentanyl, and an IV with fentanyl and an epidural. Eventually, later on in the study, towards the end of it, they grouped together the IV fentanyl into 2 groups for further study. The study design. So this was not a controlled randomized group. It was broken down into the 4 groups of different types of exposure, besides the first group, which was no exposure. This was conducted in Norway in a maternity unit from births between 2016 to 2018. And the data was collected by seeing which mothers exclusively breastfed in the postpartum period, and the data collected to see who was exposed to fentanyl was from hospital records. And the study findings was that the use of epidurals was shown to double the odds of non-exclusive breastfeeding, a bit over 50%. And this shocked me because I thought that it would be high, but I did not think that it would be over double just from the epidural. And the use of both IV fentanyl and an epidural with fentanyl was over 50%. So fentanyl has absolutely been shown through a credible article that it does decrease exclusive breastfeeding and has effects on the baby, like I've seen in hospital births before. And spontaneous suckling post-birth from the baby was negatively associated with any use of fentanyl, whether it was IV, an epidural, or both. And it was also shown that even small amounts of fentanyl had an effect on the baby with drowsiness. And the mothers not exposed to fentanyl had a much higher rate of exclusive breastfeeding. And the further research questions that the researchers were thinking about looking into was, researchers did ask within the study for further research to optimize the fentanyl dose en route in labor settings. I would like to see this as well, to see potentially, depending on the dose, if there's mothers that would be open to a lower dose to see if that would up their rates of potentially exclusively breastfeeding for at least the first 6 months of the baby's life. And for me, I would like to see the difference in mothers with Pitocin and an epidural to see if the synthetic oxytocin disrupts breastfeeding hormones as well. And this is my APA format reference. Thank you.